We very much view GLPs as an enabler to care, not as a replacement for care, right? So I think that's a really big miss in the market. And, look, the reality is like, I think that's probably a less compelling pitch on TikTok, which is like, I lost, 80 pounds with this drug and also like all of these things I was doing. And then look, I also think the reality is like, even the best executed solution. So even if we said we have GLPs, every single person's getting the support they need with social determinants of health and accessing food and food changes, and as like all of that is true, the reality is still like you need to match people to the right care. And in order for it to drive value, you have to target the right people. And so I think the reality is when you have 45% of the country with obesity, we're oftentimes not thinking about what is the right care for different people within that 45%. And how do I actually make sure that the people who need the care the most, the very high acuity individuals or ones with multiple comorbidities or really declining metabolic health, are accessing the care? And so I think amazing that we have this sort of transformative technology, but it's not enough. And so much more needs to be done to drive clinical value. And then so much more than that also needs to be done to then also drive financial value.